Well, it's time for our health report. Joining us now is Africa 54 health correspondent Linord Moudou. Hello, Linord.
Hello, Vincent. Hello, everyone. More than 60 people have died after drinking from a batch of illegal liquor in Kenya. This is the largest number of people killed in a single incident for several years. Dozens of people were also hospitalized, some of them after going blind. Authorities say investigations into the source of the drinks are ongoing. And the World Health Organization says the spread of polio is now an international public health emergency that could grow in the coming month. Polio usually strikes children under the age of 5 and is most often spread through infected water. In 1988, there were 350,000 cases of the crippling disease. Last year, there were 417 cases. WHO says currently there are polio outbreaks in 10 countries in Asia, Africa, and the Middle East. Experts are particularly concerned that polio is re-emerging in countries previously free of the disease, including Cameroon, Equatorial Guinea, Ethiopia, and Israel. Now to Uganda, where a new project at a prison is helping to prevent the spread of tuberculosis by providing improved health services to the inmates. Here at the Uganda Prison in northern Uganda, new prisoners are isolated and tested for tuberculosis, HIV/AIDS, malaria, and other infections. Behind bars, the frequency of all three conditions are usually high due to overcrowding, unsanitary conditions, and inadequate screening and treatment. After screening, those who are infected with TB are separated from the rest of the prison population, while healthcare providers ensure they take their drugs and complete their treatment.
The risk of not continuing with the TB treatment is that you are at a risk of death. You are at a risk of developing multi-drug resistance TB, which is a bit very expensive to manage in our country.
The program was launched in 2009 by the International Red Cross Committee and handed over to Ugandan authorities in 2012. Prison laboratories have since been upgraded with better diagnostic and testing equipment. They can operate around the clock thanks to a regular electricity and water supply.
When we were brought here, we have been advised on HIV/AIDS. We could go for the HIV counseling and testing, and the services here provided freely.
Prisoners with TB and HIV continue the treatment even after release thanks to the follow-up care in local clinics. This has reduced the spread of diseases to the wider community. Jeffrey was in Gulu prison for 6 months. He had TB and was diagnosed HIV positive.
At Gulu Central Prison, what I learned was that when I leave, my family should remind me to take my medication if I forget.
The prison health center also provides high-quality health care for the local population.
What we have gone through in the last 5 years is a great transformation from a system that is rudimentary to something much modern that has served for the benefit of the inmates, staff, and the neighboring community who actually access services, because the quality of services they do get from the prisons is much better than even at an outside health facility.
The treatment success rate for inmates with TB rose from over 60% in 2009 to over 80% in 2012. The program has now been implemented in 3 prisons, and Ugandan officials plan to expand it to more jails across the country. And that's our Africa Health Report for today. Back to you, Vincent.